my name is Natalie Jimenez. Today I'm going to present the tetanus disease. The tetanus disease is an acute infection, bacterial disease characterized by tonic spasm, voluntary muscles, especially of the jaw, and caused by an exotoxin, which is called Clostridium tetani, which is usually introduced through a wound. Um, the main types of tetanus disease, we're going to have four. The first one is the generalized tetanus. Uh, it is the most common type. 80% of the patients present it. This one usually presents a descending pattern from the jaw on the facial muscles that after 48 hours it is going to descend to the extensor muscles of the limbs. The first sign is dressness of locked jaw, followed by stiffness of the neck and difficult to swallow. These spasms can occur for up to 4 weeks. The second one is the localized tetanus. The clinical characteristics are persistent contraction of the muscles at the site of injury that can persist for many weeks. This type is uncommonly fatal, but it can progress to generalized tetanus. The third one is the neonatal tetanus. It occurs in newborns of immunized mothers or from infections through a contaminated instrument when cutting the umbilical cord. The clinical characteristics of neonatal tetanus are irritability, poor feeding, facial grimacing, rigidity, and severe spastic contractions triggered by touch. Also, the long-term consequence of neonatal tetanus are behavioral problems, deficit in gross motor, speech and language development. The fourth one is the cephalic tetanus. It occurs most commonly after a head trauma, such as skull fracture, head lacerations, or eye injury. The clinical characteristics of cephalic tetanus are neck stiffness, dysphagia, trismus, retracted eyelids, and rhesus sardonicus. This kind of tetanus can lead to further complications such as bronchoaspiration, paralysis of the respiratory muscles. This type of tetanus also can progress to a generalized tetanus. The signs and symptoms of tetanus are going to include trismus, trismus, that's commonly called lockjaw. It is a reduced opening of the jaws, which caused by spasm of the muscles of mastication. Also is going to present the spasm in the jaw, face, and neck muscles, which are involuntary movements in one or more muscles. Also, the typical characteristic of tetanus is the rhesus sardonicus, that it is also called rictus green. It's a highly characteristic in tetanus where occur a spasm of the facial muscles. The patient also is going to present dysphagia. It means that the patient is going to have problems to swallow certain foods or liquids. Also is going to present fever, dyspnea, hypertension, tachycardia, sweating, and epistaxionus, which is a spasm of the muscles which cause the backward arcing of the head, the neck, and the spine that is going to be progressively until the patient dies. The The causative agent is the Clostridium tetani. The Clostridium tetani is going to be Bacillus rod-shaped gram-positive bacterium. It is formed for multiple layers of peptidoglycan and one inner membrane. It's going to be a motile bacteria, which use rotary flagellum movements in the Petricus orientation. It's going to be sensitive to heat and cannot survive in the presence of oxygen during vegetative growth. Also, it synthesizes ATP through the use of sodium and fermentation. It is forming of spores that are highly resistant heat and most antiseptics. The spores are found in soils, dust, animals' intestinal tract, and on human skin. The pathogenesis of tetanus is going to start in the first picture. Is when the Clostridium tetani entered through the body through the wound and stays sporulated from until anaerobic conditions are present. It germinates, producing the tetanus plasmin and begins to multiply. The tetanus plasmin is going to spread using the blood and the lymphatic system. After tetanus plasmin will bind with the motor neurons and travel along the spine cord. It's going to travel along the spine cord. Once in the spine cord, in the second image, we're going to see. Once in the spine cord, the spores are going to develop into a vegetative form of the bacilli, which produces and releases a neurotropic exotoxin that is called tetanus plasmin. It is transport with blood and lymph and taken up via endocytosis by the axons of the nerve cells. Once inside the neuron, tetanus toxin cannot be neutralized by antitoxin, and the toxin is going to release the inhibitory neurotransmitters glycine and the gamma amino butyric acid in the central nervous system, making the excitatory nerve impulses unopposed, resulting in muscle spasms. The virulence factors. The Clostridium tetani is going to produce two toxins that are the tetanolysin and tetanus plasmin. The tetanolysin mechanism of action is when it binds to membrane of cholesterol and forms spores in the cytoplasmic membranes, causing permeability changes in the cell membrane and other biologic membranes, resulting in a cell lysis. The second one is the tetanus plasmin. It is responsible for disease manifestation. The tetanus neurotoxin is released upon cell lysis after bacterial growth under anaerobic conditions. An example of it is the deep puncture, where it is contaminated. Epidemiology. The epidemiology, the Clostridium tetani is going to be found in soil. inanimate objects, animal feces, and sometimes in animal feces or in human feces. The tetanus is predominantly a disease underdeveloped countries. It is common in areas where soil is cultivated, in rural areas, warm climates, during summer months, and among males. In countries without a comprehensive immunization program, tetanus predominantly develops in neonates and young children. The age-related demographics, neonatal tetanus is rare and occurring most frequently in countries without comprehensive vaccination programs. In the United States, 59% of the cases and 75% of the death occurs in persons over 60 years or over 60 years old. The sex-related demographics, tetanus affect both sex. In the United States was 2.8 times higher in males than in females. The race-related demographics, from 1998 to 2018, the incidence of tetanus in the United States was the highest among Hispanics, white, and African Americans. The transmission. The transmission is going to occur through the Clostridium tetani. The Clostridium tetani is primarily saprophytic. It means that he lives in the dead or decaying matter and only incidentally infect humans. The transmission occurs when the Clostridium tetani endospores enter through wounds, cuts, and lacerations. The transmission also occurs through deep puncture and unsterilized surgery instruments. In the neonatal tetanus case, the transmission will occur from a no-humanized mother and from an unhealed baby's umbilical stump. And the most important, the transmission does not occur from person to person. The clinical diagnosis is going to be entered through a physical exam. The physical exam is going to be the immunization history of the patient. They are going to observe the muscle spasms, the stiffness, the pain, and also culture tests that are going to help to diagnose this disease. And the culture diagnosis, the specimen type is serum. It is collected by the extraction of a small portion of the depth of the necrotic wound. In gram staining, as we see in the picture, reveals gram positive bacilli with terminal round. Here with the terminal round, where the spores look like as a drumstick appearance and tennis racket appearance. Also for culture diagnosis test, we're going to have to Robertson cooked meat broth. In this, the Clostridium tetani being proteolytic and turns the meat particles black and produces a full odor. We're going to have the blood agar with polymyxin V. The Clostridium tetani produce a characteristic swarming growth when we incubate it at 37 degrees Celsius for 24 to 48 hours under anaerobic conditions. Another test is the toxigenicity test, where the in vitro hemolysis inhibition test. This test is going to indicate the tetanolysin production. The Clostridium tetani produce hemolysis on blood agar, which is inhibited by adding antitoxin. The in vivo mouse inoculate test. This test is going to indicate the production of tetanus plasmin. Here we use the Robert Cook meat broth. The Robert Cook meat broth is going to look turbid black growth. It is injected into the root of the tail of the mouse, and the test animal develops a stiffness, which begins with the tail and progresses to involve the inoculate sites, hind limbs, and the death of the mouse is going to occur in 2 days. The treatment of tetanus is medical treatments that has 2 aims. The first one is to limit growth and eventually kill the infecting Clostridium tetani, and thus eliminate toxin production. The second aim is to neutralize any toxin that is formed. The medication is going to be based on tetanus immunoglobulin, which is going to neutralize the toxin that has not yet bonded to the nerve tissue. The antibiotics are the metronidazole every 6 to 8 hours, and the penicillin for 7 to 10 days. The sedatives, doctors generally use powerful sedatives to control the muscle spasms. The benzodiazepines, 5 to 15 milligrams per hour during. Other drugs to regulate the involuntary muscle activity are the magnesium sulfate and certain beta blockers. And also the supportive care that is going to be based in mechanical ventilation, since the patient is not going to have the ability to breathe because of the stiffness of the muscles. And the prevention, immunization is the only effective prevention in tetanus. Tetanus toxoid is an effective, safe, stable, and expensive vaccine. It can be given to all of ages. Most countries recommend 5 doses of tetanus toxoid vaccine over 12 to 15 years, starting in the infancy. And further booster doses can be given in early adulthood to ensure long-lasting protection. Immunization pregnant woman remains an essential intervention from neonatal tetanus prevention. Also, good wound care. Clean the wound to prevent the growth of tetanus endospores immediately, and good wound care can also help the prevention of infection. We don't have to delay the first aid, and even minor non-infected wounds like blisters, scrapes, or any break in the skin. And also we have to wash the hands often with soap and water. Here's my bibliography. Thank you so much.